I will start by reviewing the physician's order for irrigation solution to be used. I will then assess the patient's pain level and administer pain medication 30 minutes prior if necessary. Next, I'm going to raise the bed to a safe working height, provide privacy. Can I get your name and date of birth? Good. All right, wristband matches up. I am going to warm my irrigation solution to body temperature. I am then going to perform hand hygiene. Get some gloves on here, Mr. Smith. Oh boy. I grabbed an extra. Dispose of that. Okay, Mr. Smith, we're just gonna go ahead and get you into a comfortable position, okay? All right. I'm gonna get my soaker pad for any runoff and to protect your bedding. Now I'm gonna get my basin. And we're just gonna go ahead and remove those Montgomery straps, okay? All right, I'm going to remove the ABD pad and note any blood or discharge from removing. I will then remove my 4x4 dressing. I do not see anything. Okay, I do smell a foul odor. And I do see undermining at 2 o'clock and 9 o'clock. And there is some undermining present along with bone. So, Mr. Smith, I'm just gonna go ahead and get some measurements, okay? So, we have about a 6 by 6 centimeter. And that depth is about 2.5 centimeters, okay? Next, I'm gonna dispose of my gloves, perform hand hygiene. I'm going to document these findings that I just assessed, and now I'm going to perform hand hygiene again, and we are going to begin to set up the sterile field. So grabbing our 1-inch border away. All right, next we are going to bring our sterile supplies to our sterile field. We will start with the ABD pad. Next, we will put our syringe. All right, we will begin to put our sterile gloves on. Go ahead and fix these. Now that we got those sterile gloves on. Okay. We are going to throw that on the floor. Okay, so we are going to begin to draw up 35 mils of our solution, and we are going to irrigate from back and forth. And we are going to do this until drainage runs clear, and drainage is running clear, so we're going to dispose of our syringe. Next, we're going to go ahead, just move that. We are going to pat dry our wound. Dispose of that. All right, we're gonna get our next gauze. Undo it. And we're going to dip this into our solution. Get all the excess out. Wrap around our fingers. Get our... Okay, I'm gonna begin to pack this wound, okay? You just go ahead and let me know if you have any pain or discomfort while I am doing this, okay, Mr. Smith? Okay. Once we have that wound packed, we're gonna go ahead and get another 4x4 gauze and apply that. Next, we're gonna grab our ABD pad and secure that. And we're gonna hook the Montgomery straps, and then we would document the date and time of which this wound dressing was performed. And we are going to do it with pen and not marker. Okay. All right, we would assess Mr. Smith for any pain that he was feeling. Dispose of our materials. We would then get Mr. Smith into a comfortable position. Again, we would assess for any pain. We would put his bed down to a safe place, and we would provide him with his call light. And then I would notify the physician if there was any resistance with irrigation, if there was any blood, or if the patient experienced severe pain, along with any shock during this wound change. Thank you.